Diabetic retinopathy. How the diabetes affect the retina. Types of retinopathy affecting the individuals with diabetic mellitus ultimately cause the vision loss. In long-standing diabetes or poor glycemic control, chronic hyperglycemia cause the retinal vascular changes. In retinal vascular changes, abnormal vascular permeability and vascular occlusions, and this caused ischemia and production of BEGF factor, vascular endothelial growth factor, that form the abnormal blood vessels, cause neovascularization, and neovascularization cause macular edema, vitreal hemorrhage, etc. Types of diabetic retinopathy. One is proliferative diabetic retinopathy, in which presence of neovascularization, and second is non-proliferative diabetic retinopathy, absence of neovascularization. Complication of diabetic retinopathy: the vision loss due to macular edema, vitreal hemorrhage from neovascularization, retinal detachment, and neovascular glaucoma. Sign and symptoms: usually asymptomatic until the late stage. It decrease sign and symptoms. It decrease or fluctuating vision, presence of flutters, flashes of light called photopsias. How to diagnose the diabetic retinopathy? By diagnostic imaging, direct or indirect fundoscopy. Indirect and indirect fundoscopy diagnose the thickening of basement membrane, microaneurysm, microocclusions, exudates, and nerve fiber infarcts cause cotton wool spots, which can see in this picture, cotton wool spot, and intraretinal hemorrhage and macular edema. Other diagnostic is annual ophthalmologic screening and clinical representation like visual loss of decrease visual acuity. Treatment of diabetic retinopathy: first is medication. In medication we give intravitreal vascular endothelial growth factor inhibitor for proliferative diabetic retinopathy and macular edema. In surgery, laser photocoagulation of peripheral retina and vitrectomy of vitreous hemorrhage. In other intervention, control the blood vessels and blood sugar to reduce the progression of diabetic retinopathy.